Question 1. A licensed practical/vocational nurse, LPN/LVN, is caring for a client with a new colostomy. The client is visibly upset, stating, "I can't believe this is my life now. I don't even want to look at it." The stoma appears healthy, but the client refuses to participate in care. Which action should the LPN/LVN prioritize? A. Reassure the client that many people live full lives with a colostomy. B. Demonstrate how to empty the colostomy bag while the client observes. C. Document the client's emotional state and refusal to participate in care. D. Notify the registered nurse, RN, about the client's emotional distress and non-participation. Answer: D. Notify the registered nurse, RN, about the client's emotional distress and non-participation. This question tests the concept of recognizing and reporting significant client emotional distress, especially regarding a new body image change. The keywords visibly upset, "I can't believe this is my life now," and refuses to participate indicate that the client is experiencing difficulty with acceptance and adaptation. While reassurance and demonstration are important, the LPN's primary responsibility in this situation is to report the client's significant emotional state and non-participation to the RN, as this indicates a potential need for a more comprehensive assessment or intervention, such as a referral to a social worker or enterostomal therapist, which falls outside the LPN's independent scope. The LPN's role includes monitoring and reporting changes in a client's physical and emotional status, especially when it impacts their ability to engage in self-care. For example, if a client consistently refuses to eat, the LPN reports this to the RN for further evaluation. Always remember, if a client is struggling significantly with a new diagnosis or body change, report it to the RN for higher-level intervention. Question 2. The LPN/LVN is administering medications and notes that a client who is prescribed warfarin, Coumadin, has an international normalized ratio, INR, of 5.2. The client is not exhibiting any signs of bleeding. Which action should the LPN/LVN take first? A. Administer the prescribed warfarin dose as ordered. B. Hold the warfarin dose and notify the registered nurse, RN. C. Administer vitamin K as an antidote per standing orders. D. Document the INR value and continue to monitor the client. Answer: B. Hold the warfarin dose and notify the registered nurse, RN. This question tests the LPN's understanding of medication safety and recognizing abnormal laboratory values, specifically for anticoagulants. The keyword INR of 5.2 is critical because a therapeutic INR for warfarin is typically 2.0 to 3.0. An INR of 5.2 is significantly elevated and indicates a high risk of bleeding, even if no signs are currently visible. The LPN's immediate action is to hold the medication to prevent further increased risk and then notify the RN, as adjusting medication doses or administering antidotes like vitamin K requires an RN or provider order. For example, if a client's blood pressure is dangerously low before an antihypertensive medication, you would hold the medication and notify the RN. Always remember to prioritize patient safety by questioning and holding medications when laboratory values or vital signs suggest a potential harm, and then promptly report to the RN. Question 3. An LPN/LVN is caring for a client who is 2 days post-appendectomy. The client reports pain at 6/10 on a scale of 0 to 10 and asks for pain medication. The client's vital signs are stable: temperature 98.6 degrees Fahrenheit 37 degrees Celsius, heart rate 88 BPM, respirations 18 BPM, blood pressure 120/78 mmHg. The LPN notes the client is guarding the incision site. What is the most appropriate initial action for the LPN/LVN? A. Administer the prescribed opioid analgesic. B. Reassess the pain level in 30 minutes. C. Encourage the client to ambulate to promote healing. D. Apply a warm compress to the incision site. Answer: A. Administer the prescribed opioid analgesic. This question tests the LPN's ability to prioritize symptom management, specifically pain relief, in a post-surgical client. The keywords "reports pain at 6/10" and "asks for pain medication" clearly indicate the client is experiencing discomfort that needs to be addressed. Since the client's vital signs are stable, and pain is a subjective but valid complaint, the most appropriate and immediate action is to administer the prescribed pain medication. While ambulation is important for recovery, and reassessing pain is done after medication administration, these are not the initial action when a client is actively reporting significant pain. For example, if a client just had knee surgery and reports high pain, the first step is to give them their ordered pain medication. Remember that alleviating a client's pain is a priority, especially when it is within acceptable parameters for medication administration and vital signs are stable. Question 4. An LPN/LVN is performing rounds in a long-term care facility. A client with a history of heart failure reports sudden shortness of breath and states, "I can't catch my breath." The LPN observes visible neck vein distension and crackles upon auscultation of the lung bases. Which immediate action should the LPN/LVN take? A. Elevate the head of the client's bed. B. Administer a prescribed PRN diuretic. C. Notify the client's family about the change in condition. D. Document the findings in the client's chart. Answer: A. Elevate the head of the client's bed. This question focuses on immediate interventions for acute respiratory distress in a client with heart failure. The keywords "sudden shortness of breath," "can't catch my breath," "neck vein distension," and "crackles" are all classic signs of acute fluid overload leading to pulmonary edema, a serious complication of heart failure. Elevating the head of the bed is the immediate and independent nursing action that can help improve breathing by reducing venous return to the heart and easing the effort of breathing, making it the priority before other interventions like medication administration or notification. While a diuretic might be prescribed, administering it requires an order and takes time to work, and notifying family is secondary to stabilizing the client. For example, if a client feels like they are drowning due to fluid in their lungs, getting them into an upright position is the fastest way to help them breathe more easily. Remember that positioning for comfort and improved breathing is a rapid and effective initial intervention for respiratory distress. Question 5. The LPN/LVN is assisting with the admission of an older adult client from a nursing home. The LPN notes multiple pressure injuries on the client's sacrum and heels, all stage 2. The nursing home transfer report indicates that the client receives turning every 2 hours. What is the most appropriate action for the LPN/LVN to take? A. Begin a new turning schedule for the client immediately. B. Document the findings accurately and objectively in the client's medical record. C. Obtain an order from the healthcare provider for specialized wound care dressings. D. Notify the charge nurse about concerns regarding potential neglect. Answer: D. Notify the charge nurse about concerns regarding potential neglect. This question tests the LPN's ethical responsibility and understanding of reporting suspected elder abuse or neglect. The keywords "multiple pressure injuries," "all stage 2," and the conflicting information "receives turning every 2 hours" are crucial clues. Stage 2 pressure injuries, especially multiple ones, suggest inadequate pressure relief and skin care, which directly contradicts the reported turning schedule and raises a strong suspicion of neglect. While documenting is always necessary, and wound care is needed, the most appropriate initial action is to notify the charge nurse or supervising RN, as they are responsible for investigating and addressing potential neglect or abuse according to facility policy. For example, if a child comes to the clinic with unexplained bruises, the nurse's first action is to report the suspicion to the appropriate authority. Always remember that suspecting neglect or abuse requires immediate reporting to your supervisor, as it is a legal and ethical obligation. Question 6. An LPN/LVN is reinforcing discharge teaching for a client with newly diagnosed type 2 diabetes mellitus. The client states, "I understand I need to check my blood sugar, but how often should I really do it?" Which response by the LPN/LVN is most appropriate? A. You should check your blood sugar every morning before breakfast. B. It's best to check it 4 times a day, before meals and at bedtime. C. Follow the schedule your doctor gave you, and we can review it together. D. Check it when you feel symptoms of high or low blood sugar. Answer: C. Follow the schedule your doctor gave you, and we can review it together. This question assesses the LPN's role in reinforcing teaching and understanding the individualized nature of medical plans. The critical concept is that blood glucose monitoring schedules vary greatly depending on the client's specific medication regimen, e.g., insulin versus oral medications, lifestyle, and overall glycemic control goals, which are determined by the healthcare provider. The LPN's role is to reinforce the prescribed plan, not to create a new one or give a generic recommendation. By suggesting they review the doctor's schedule, the LPN ensures accurate, individualized information is reinforced. For example, when teaching a client about medication, you always refer to their specific prescription, not a general guideline. Always remember to reinforce the specific instructions given by the healthcare provider, especially for individualized care plans like blood glucose monitoring schedules. Question 7. The LPN/LVN is preparing to administer an intramuscular, IM, injection to an adult client. The medication is viscous, thick, and the client has very little muscle mass. Which needle gauge and length would be most appropriate for this injection? A. 25 gauge, 5/8 inch. B. 22 gauge, 1 inch. C. 18 gauge, 1.5 inch. D. 20 gauge, 1 inch. Answer: D. 20 gauge, 1 inch. This question tests the practical application of administering intramuscular injections, considering client factors and medication viscosity. The keywords are viscous, thick, and very little muscle mass. A viscous medication requires a larger gauge needle, smaller number, to allow the medication to flow easily, ruling out 25 G. For IM injections, a needle length that reaches the muscle is needed, but very little muscle mass suggests that a shorter IM needle is appropriate to avoid hitting bone, thus ruling out 1.5 inch, which is typically for larger muscles or larger clients. A 20 gauge, 1 inch needle strikes the best balance, allowing for the thick medication to be injected while being appropriate for a client with less muscle mass, likely into a site like the deltoid or ventrogluteal. For instance, you wouldn't use a tiny needle for thick soup. Similarly, a viscous medication needs a wider opening, but not so long it causes injury. Remember to choose needle size based on medication viscosity, client size, and the injection site to ensure safe and effective delivery. Question 8. An LPN/LVN is providing care for a client with a history of falls, who is currently confused and attempts to get out of bed unassisted. The LPN has applied a bed alarm. What is the next most important action the LPN/LVN should take? A. Check on the client every 15 minutes. B. Place a fall risk sign on the client's door. C. Ensure the call light is within the client's reach. D. Move the client to a room closer to the nursing station. Answer: C. Ensure the call light is within the client's reach. This question assesses the LPN's understanding of fall prevention strategies for a confused client. The keywords confused, attempts to get out of bed unassisted, and bed alarm indicate a high fall risk where the client might not remember to ask for help. While all options are related to fall prevention, ensuring the call light is within reach is the next most important direct intervention after applying a bed alarm, as it empowers the client to request assistance if they become less confused or need something, potentially preventing them from attempting to get up alone. Checking every 15 minutes and moving rooms are important but less immediate than empowering the client with the call light. For example, if a child is learning to ride a bike, you provide training wheels, bed alarm, but also teach them to call for help if they're stuck, call light. Always ensure a confused client has the means to call for help readily available, even if they sometimes forget to use it, as this is a fundamental safety measure. Question 9. An LPN/LVN is caring for a client with chronic obstructive pulmonary disease, COPD, who uses oxygen at 2 liters per minute via nasal cannula. The client reports increasing shortness of breath and feels tired all the time. The LPN notes the client's oxygen saturation is 88%. Which action should the LPN/LVN take first? A. Increase the oxygen flow rate to 4 liters per minute. B. Encourage the client to perform pursed lip breathing. C. Notify the registered nurse, RN, of the client's symptoms and SpO2. D. Document the client's complaint and oxygen saturation. Answer: C. Notify the registered nurse, RN, of the client's symptoms and SpO2. This question tests the LPN's ability to recognize a significant change in a client's respiratory status and prioritize reporting. The keywords increasing shortness of breath, tired all the time, and oxygen saturation is 88% indicate a worsening respiratory condition in a client with COPD. While pursed lip breathing is helpful, and increasing oxygen might seem intuitive, an LPN should not independently change the oxygen flow rate significantly without an order, especially in COPD where excessive oxygen can suppress the respiratory drive. Therefore, the most critical first action is to notify the RN, who can assess further, obtain new orders, and determine the appropriate intervention. For example, if a client with diabetes has a blood sugar of 40 mg per deciliter, you wouldn't just offer them juice, you'd report to the RN immediately for intervention. Always remember to report significant changes in a client's condition, especially vital signs indicating instability, to the RN promptly for higher-level assessment and intervention. Question 10. The LPN/LVN is observing a newly hired unlicensed assistive personnel, UAP, provide care for a client. The UAP is preparing to ambulate a client who has a weak left side. The UAP positions herself on the client's strong right side. What action should the LPN/LVN take? A. Allow the UAP to proceed, observing closely for client safety. B. Instruct the UAP to position herself on the client's weak left side. C. Advise the UAP to use a gait belt to assist with ambulation. D. Take over the task from the UAP to ensure client safety. Answer: B. Instruct the UAP to position herself on the client's weak left side. This question assesses the LPN's role in supervision and correction of UAP performance, specifically in client safety during ambulation. The keyword weak left side is crucial, as the UAP should always stand on the client's weaker side during ambulation to provide support if the client loses balance and to prevent falls. The LPN's responsibility is to ensure safe care delivery, and this is a correctable action within the UAP's scope. Directly instructing the UAP on the correct positioning is the most appropriate action, reinforcing proper technique and immediately ensuring client safety. While a gait belt is good, the positioning is the immediate safety concern. For example, if a UAP is about to lift a client incorrectly, you would immediately correct their technique rather than just watching or taking over. Always prioritize correcting unsafe practice by providing immediate, specific instruction to UAP to ensure client safety. Question 11. An LPN/LVN is assisting with the care of a client diagnosed with Clostridium difficile, C. diff, infection. The client has watery diarrhea. Which personal protective equipment, PPE, should the LPN/LVN wear when entering the client's room? A. Gown and gloves. B. Surgical mask and gloves. C. N95 respirator and gown. D. Gown, gloves, and surgical mask. Answer: A. Gown and gloves. This question tests the LPN's knowledge of proper isolation precautions for C. diff infection. The keyword Clostridium difficile, C. diff, indicates that contact precautions are necessary, as C. diff is transmitted through spores that are not killed by alcohol-based hand rub and require soap and water hand washing. Contact precautions specifically mandate the use of a gown and gloves to prevent direct contact with the client or contaminated surfaces. Masks are not required unless splashes are anticipated or if the client has another co-infection requiring droplet/airborne precautions. For example, when changing a diaper on a baby with C. diff, you would put on a gown and gloves to protect your clothes and hands from contamination. Always remember that C. diff requires meticulous hand hygiene with soap and water and contact precautions, primarily gown and gloves, to prevent its spread. Question 12. An LPN/LVN is performing wound care for a client with a stage 3 pressure injury on the sacrum. The wound bed has a moderate amount of yellow slue and some granulation tissue. Which type of dressing would the LPN/LVN anticipate the RN or provider will order? A. Transparent film dressing. B. Hydrocolloid dressing. C. Alginate dressing. D. Wet to dry dressing. Answer: B. Hydrocolloid dressing. This question assesses the LPN's understanding of wound care principles and anticipated interventions for a specific wound type. The keywords stage 3 pressure injury, yellow slue, and granulation tissue are crucial. A hydrocolloid dressing is well suited for stage 2 to 3 pressure injuries with light to moderate exudate and slue, as it helps debride, remove, the slue by providing a moist environment and can also protect the granulation tissue. Transparent films are for minimal exudate or protection, alginates are for heavy exudate, and wet-to-dry dressings are generally less preferred due to non-selective debridement and pain. For example, a hydrocolloid acts like a self-contained moist bandage that gently cleans the wound and helps it heal, similar to how a blister bandage works. Remember that hydrocolloid dressings are excellent for pressure injuries with some slue and moderate drainage, promoting autolytic debridement and moist wound healing. Question 13. The LPN/LVN is reinforcing teaching to a client with a new prescription for metoprolol, low pressor. Which statement by the client indicates a need for further teaching? A. I should stand up slowly after taking this medication. B. I will check my heart rate and blood pressure every day. C. I can stop taking this medication if my blood pressure is normal. D. This medication will help lower my blood pressure. Answer: C. I can stop taking this medication if my blood pressure is normal. This question tests the LPN's ability to identify incorrect client understanding regarding a common cardiovascular medication. The keyword metoprolol is a beta blocker, and the statement, I can stop taking this medication if my blood pressure is normal, reveals a critical misunderstanding. Beta blockers, especially for conditions like hypertension or heart failure, should never be abruptly stopped, as this can lead to rebound hypertension, angina, or other serious cardiac events. They are typically for long-term management and require gradual tapering under medical supervision. The other statements are correct patient teaching points. For instance, if you suddenly stop taking medication for a chronic condition, your symptoms could return worse than before. Always emphasize the importance of not discontinuing prescribed medications without consulting the healthcare provider, especially for conditions like hypertension or heart disease. Question 14. An LPN/LVN is reviewing the electronic health record of a client admitted with pneumonia. The client's temperature has been consistently elevated at 101.5 degrees Fahrenheit 38.6 degrees Celsius for the past 24 hours despite antibiotic administration. The client is also complaining of increased cough and sputum production. What is the most appropriate action for the LPN/LVN? A. Administer an antipyretic medication. B. Encourage increased fluid intake. C. Notify the registered nurse, RN, about the client's worsening condition. D. Document the findings in the client's chart. Answer: C. Notify the registered nurse, RN, about the client's worsening condition. This question assesses the LPN's ability to identify and report signs of a client's deteriorating condition, even when standard treatments are in place. The keywords consistently elevated at 101.5 degrees Fahrenheit 38.6 degrees Celsius for the past 24 hours despite antibiotic administration and increased cough and sputum production indicate that the client's pneumonia is not improving as expected with treatment and may be worsening. While fluids and antipyretics are supportive measures, the LPN's primary responsibility is to recognize this lack of expected improvement and notify the RN so that further assessment, diagnostic tests, or a change in the treatment plan can be considered. For example, if a client's wound isn't healing after several days of treatment, you would report it to the RN for re-evaluation. Always remember to report when a client's condition is not improving as expected, or when symptoms are worsening despite interventions, as this often requires a higher level of assessment. Question 15. The LPN/LVN is assisting a client with a history of dysphagia, difficulty swallowing, during mealtime. The client begins to cough forcefully during the meal. What is the immediate priority action for the LPN/LVN? A. Encourage the client to continue coughing. B. Offer sips of water to help clear the airway. C. Initiate abdominal thrusts, Heimlich maneuver. D. Immediately suction the client's airway. Answer: A. Encourage the client to continue coughing. This question tests the LPN's knowledge of immediate interventions for a client who is choking. The keyword cough forcefully is the critical clue. A forceful cough indicates that the client has a partial airway obstruction and is still able to move air. Encouraging the client to continue coughing is the most appropriate initial action, as a forceful cough is the most effective way to clear a partial obstruction. Offering sips of water or immediately performing abdominal thrusts or suctioning are not indicated for a partial obstruction. Abdominal thrusts are for complete obstruction, and water or suctioning could worsen the situation by pushing the obstruction further down. For example, if someone starts choking but can still cough strongly, you would tell them to keep coughing because their own body is trying to clear it. Always remember that a forceful cough indicates a partial airway obstruction, and encouraging the client to continue coughing is the most effective initial intervention. Question 16. An LPN/LVN is caring for a client with a new peripherally inserted central catheter, PICC, line. The client reports pain at the insertion site and the LPN observes slight redness and swelling. Which is the most appropriate initial action for the LPN/LVN? A. Apply a warm compress to the site. B. Document the findings and continue to monitor. C. Notify the registered nurse, RN, of the findings. D. Administer a PRN pain medication. Answer: C. Notify the registered nurse, RN, of the findings. This question tests the LPN's ability to identify potential complications related to central venous access devices and initiate appropriate reporting. The keywords PICC line, pain at the insertion site, and slight redness and swelling are crucial, as these are early signs of potential complications like phlebitis, infection, or infiltration. An LPN should not independently apply compresses or administer pain medication for these specific symptoms related to a central line without further assessment by an RN or provider. Notifying the RN is the most appropriate initial action to ensure a comprehensive assessment and timely intervention to prevent further complications. For example, if an foresight looks red and swollen, you report it to the RN immediately because it could be getting infected. Always remember that any signs of inflammation or pain at a central line insertion site warrant immediate reporting to the RN for further evaluation. Question 17. The LPN/LVN is preparing to administer morning medications to a client who has diabetes. The client's breakfast tray has not yet arrived. The LPN notes an order for insulin glargine, Lantus, 10 units subcutaneously, and insulin aspart, Novolog, 5 units subcutaneously. Which action should the LPN/LVN take? A. Administer both insulin glargine and insulin aspart. B. Administer insulin glargine and hold insulin aspart. C. Hold both insulin glargine and insulin aspart until breakfast arrives. D. Administer insulin aspart and hold insulin glargine. Answer: B. Administer insulin glargine and hold insulin aspart. This question assesses the LPN's understanding of different types of insulin and their administration timing. The keywords breakfast tray has not yet arrived and insulin glargine, Lantus, versus insulin aspart, Novolog, are critical. Insulin glargine, Lantus, is a long-acting basal insulin, meaning it provides a steady insulin level over 24 hours and is typically given at the same time each day, regardless of meals. Insulin aspart, Novolog, is a rapid-acting insulin given to cover carbohydrate intake and should only be administered when a meal is immediately available to prevent hypoglycemia. Therefore, the LPN should administer the long-acting insulin but hold the rapid-acting insulin until the meal is present. For instance, you wouldn't give fast-acting insulin unless food is right there, just like you wouldn't fill a car's tank if the gas station isn't open. Always remember that long-acting insulin is given independently of meals, while rapid-acting insulin must be given in conjunction with a meal to prevent dangerous low blood sugar. Question 18. An LPN/LVN is performing admission data collection for an older adult client who reports recent weight loss, fatigue, and feeling cold all the time. The client's skin is dry, and the LPN notes mild periorbital edema. The client's vital signs are within normal limits, except for a heart rate of 58 BPM. Which condition should the LPN/LVN suspect and report to the RN? A. Hyperthyroidism. B. Hypothyroidism. C. Diabetes mellitus. D. Renal failure. Answer: B. Hypothyroidism. This question tests the LPN's ability to connect various symptoms to a potential medical condition, specifically endocrine disorders. The keywords weight loss, fatigue, feeling cold all the time, dry skin, mild periorbital edema, and heart rate of 58 BPM are classic signs and symptoms of hypothyroidism, underactive thyroid. While weight loss is usually associated with hyperthyroidism, the combination of cold intolerance, fatigue, dry skin, edema, and a low heart rate points strongly to hypothyroidism. Reporting these findings to the RN is crucial for further assessment and diagnostic testing. For example, if someone constantly feels sluggish and cold despite warm weather, it might be their thyroid isn't working enough. Always remember that a cluster of symptoms, especially relating to metabolism and energy levels like cold intolerance and fatigue, can often point to a specific endocrine imbalance like hypothyroidism. Question 19. An LPN/LVN is assisting with the care of a client with a feeding tube who is receiving continuous enteral nutrition. The LPN notes that the client has developed diarrhea. Which action should the LPN/LVN take first? A. Slow the rate of the enteral feeding. B. Request an order for an antidiarrheal medication. C. Administer plain water flush through the feeding tube. D. Check the residual volume in the client's stomach. Answer A. Slow the rate of the enteral feeding. This question assesses the LPN's initial interventions for common complications of enteral nutrition. The keyword diarrhea is a common side effect of rapid administration or high osmolarity of enteral feedings. Slowing the rate of the feeding is a common and often effective first independent action the LPN can take to address diarrhea related to enteral nutrition, as it allows for better absorption and tolerance. While other interventions may follow, slowing the rate is a safe and immediate adjustment that falls within the LPN's monitoring and management scope, often done with standing orders or as an initial nursing judgment before notifying the RN. For example, if someone drinks a sugary drink too fast, they might get an upset stomach. Slowing down helps. Always remember that diarrhea during enteral feedings often indicates intolerance to the rate or formula, and slowing the infusion rate is a good initial step. Question 20. The LPN/LVN is preparing to discharge a client who had a urinary tract infection, UTI, and was treated with antibiotics. The client states, "I feel so much better, I'm going to stop taking these pills once I get home." Which statement is the most appropriate response by the LPN/LVN? A. That's great you're feeling better, but you must finish all your antibiotics. B. You can stop taking them if you don't have a fever anymore. C. Stopping antibiotics early can make your infection come back stronger. D. Make sure you drink plenty of cranberry juice to prevent another UTI. Answer: C. Stopping antibiotics early can make your infection come back stronger. This question tests the LPN's ability to provide effective and critical client teaching about antibiotic adherence. The keyword "stop taking these pills once I get home" indicates a dangerous misunderstanding. While stating they must finish, option A, is true, explaining why, option C, by highlighting the risk of antibiotic resistance and recurrent, harder-to-treat infections is a more impactful and client-centered teaching approach. This response directly addresses the consequence of non-adherence. For example, if you don't finish a course of bug spray, some bugs might survive and become resistant to it next time. Always emphasize the critical importance of completing the full course of antibiotics, even when symptoms resolve, to prevent antibiotic resistance and recurrence. Question 21. An LPN/LVN is reinforcing teaching to the family of a client with Alzheimer's disease who experiences sundowning. Which suggestion should the LPN/LVN offer to help manage this behavior? A. Encourage daily naps to reduce fatigue. B. Keep the environment brightly lit in the evenings. C. Engage the client in stimulating activities before bedtime. D. Maintain a consistent daily routine. Answer: D. Maintain a consistent daily routine. This question assesses the LPN's understanding of practical interventions for managing sundowning syndrome in clients with dementia. Sundowning is characterized by increased confusion, agitation, and restlessness in the late afternoon or evening. The keyword sundowning is key. Maintaining a consistent daily routine helps orient the client, reduces confusion, and provides a sense of predictability and security, which can significantly reduce agitation associated with sundowning. Bright lights might exacerbate agitation, naps can disrupt nighttime sleep, and stimulating activities before bed are counterproductive. For instance, children often do better with a regular bedtime routine. Adults with dementia also benefit from predictability. Always remember that a consistent daily routine, including sleep-wake cycles and activities, is a fundamental strategy for managing sundowning in clients with Alzheimer's disease. Question 22. The LPN/LVN is providing care for a client with a new cast on the right forearm following a fracture. The client complains of numbness and tingling in the right fingers, and the LPN notes that the fingers are slightly swollen and pale. Which action should the LPN/LVN take first? A. Elevate the client's right arm on pillows. B. Administer a PRN pain medication. C. Notify the registered nurse, RN, immediately. D. Apply ice packs to the swollen fingers. Answer: C. Notify the registered nurse, RN, immediately. This question tests the LPN's ability to recognize signs of a potentially serious complication and prioritize reporting. The keywords numbness and tingling, slightly swollen, and pale in the fingers of a limb with a new cast are classic signs of neurovascular compromise, specifically compartment syndrome or impaired circulation, which is a medical emergency. These symptoms indicate that blood flow and nerve function might be compromised, which could lead to permanent tissue damage. The LPN's immediate priority is to notify the RN, who will then assess and likely contact the healthcare provider to assess the need for urgent intervention, e.g., cast removal, fasciotomy. For example, if a limb with a cast loses color and sensation, it's a critical emergency needing immediate attention from higher-level staff. Always remember that any signs of impaired circulation or nerve function in an extremity with a cast or bandage require immediate notification of the RN. Question 23. An LPN/LVN is performing oral care for an unconscious client. Which action is most important to prevent complications? A. Using a hard-bristled toothbrush to ensure thorough cleaning. B. Placing the client in a supine position to facilitate access to the mouth. C. Turning the client on their side with the head dependent during care. D. Applying petroleum jelly to the client's lips after care. Answer: C. Turning the client on their side with the head dependent during care. This question assesses the LPN's understanding of safety measures during oral care for an unconscious client. The most important consideration for an unconscious client is preventing aspiration, which is the inhalation of fluid or food into the lungs. By turning the client on their side with the head dependent, lower than the body, any fluids, such as water or saliva, will drain out of the mouth by gravity rather than being aspirated into the airway. Using a hard-bristled brush is not appropriate. A supine position increases aspiration risk, and lip care is secondary to aspiration prevention. For example, when you give an unconscious person a drink, you make sure they are positioned so they don't choke. Always remember that positioning an unconscious client on their side with the head lower is crucial during oral care to prevent aspiration. Question 24. The LPN/LVN is caring for a client with a history of seizures who is prescribed phenytoin, Dilantin. The client's morning dose is due, and the LPN notes the client is exhibiting nystagmus, involuntary eye movements, and unsteady gait. What is the most appropriate action for the LPN/LVN? A. Administer the phenytoin as prescribed. B. Hold the phenytoin and notify the registered nurse, RN. C. Document the findings and monitor the client for seizure activity. D. Request an immediate phenytoin blood level test. Answer: B. Hold the phenytoin and notify the registered nurse, RN. This question tests the LPN's ability to recognize signs of medication toxicity, specifically with anticonvulsants. The keywords phenytoin, Dilantin, nystagmus, and unsteady gait are critical, as these are classic signs of phenytoin toxicity. An LPN's primary responsibility is to prevent harm. Administering another dose of phenytoin when the client is already showing signs of toxicity would worsen the situation. Therefore, holding the medication and immediately notifying the RN is the most appropriate action so that the RN can assess further, contact the healthcare provider, and potentially obtain orders for a phenytoin level or dose adjustment. For example, if a client on blood thinner medication shows signs of bleeding, you wouldn't give the next dose, you'd hold it and report immediately. Always remember to hold medications and report to the RN if the client exhibits signs of toxicity or adverse effects, especially with narrow therapeutic index drugs like phenytoin. Question 25. An LPN/LVN is reviewing the meal tray for a client with end-stage renal disease, ESRD, on hemodialysis. Which food item, if present on the client's tray, should the LPN/LVN question? A. A small portion of grilled chicken. B. A serving of fresh strawberries. C. A large glass of milk. D. A slice of white bread. Answer: C. A large glass of milk. This question assesses the LPN's knowledge of dietary restrictions for clients with end-stage renal disease, ESRD, on hemodialysis. The keywords end-stage renal disease, ESRD, and hemodialysis are crucial. Clients with ESRD need to restrict intake of potassium, phosphorus, and fluid. Milk is very high in phosphorus and potassium, making a large glass of milk an inappropriate and potentially harmful food choice for a client on hemodialysis. Grilled chicken, protein, strawberries, low-potassium fruit, and white bread, lower in phosphorus/potassium than whole wheat, are generally more acceptable in controlled portions. For example, clients with kidney failure often can't process excess minerals from foods like dairy, so too much can make them sick. Always remember that dairy products, like milk, are high in phosphorus and potassium and are often restricted for clients with ESRD on dialysis.